Hey guys, time for part 2. So the second part of the question that I was given was, I keep confusing the timelines, especially with mania and bipolar mood disorder. So let's talk about that, and how this can be confused for schizophrenia. The thing is that on the wards, bipolar disorder and schizophrenia are very hard to tell apart. On your tests they won't be. On the tests they'll keep them very strictly separate. So let's take a look. Let's look. Dig Fast is actually a spectacular mnemonic. I really like it. Let's go through it, as we have here in first aid. So, let's remember. First off, what's your timeline for depressive symptoms? Siggy caps, which I do not like as much. Siggy caps has to last for at least 2 weeks for you to be depressed. That's it. 2 weeks. Mania, however, much like everything else about bipolar, is faster. And you only need 1 week of manic symptoms to say, okay, this is bipolar disorder. So let's talk about the symptoms of mania. Mania has the Dig Fast mnemonic. The first D is distractibility. One of the ways you'll see this, and you might have a standardized patient who does this, they'll be flipping through the magazines, and then they'll go check their purse for something, and then they're on their phone, and then they're cleaning their nails, and then they go back to the magazine, right? These people, they're actively being distracted by the things around them. They've got tons of energy, everything needs their attention, and you can't keep their eyes on yours. They're not going to sit still in your chair. Irresponsibility. So this is one of the big hallmarks. When I was on the wards, one of the ways I would ask about people being if they had mania, because people don't really know. You ask, when was the last time you were in a really good mood? And they'll give you a time to say, hey, when you were in that really good mood, when you're in one of those really good moods, have you ever done something you regretted, gotten in a fight, maybe got in trouble with the cops, spent a lot of money you didn't have? That's the irresponsibility component, and it's a really good screening question to ask someone about mania, because most people don't register mania as a problem. It's very egosyntonic. You feel fantastic. I mean, look at the G, the grandiosity. People think they are amazing. You know, you have someone who's decided they're going to quit their job and go be a rock star because they just know. They just know that's what's right for them, right? I told you in a previous video I had a patient who believed that he was a secret agent sent undercover into the psych ward to protect the psychiatrists from the more dangerous patients. We actually had to move him up to a higher functioning ward to make sure he didn't start any fights. So yeah, those are your delusions of grandeur. And those are pretty easy to spot. They'll make it crystal clear on the exam. Let's look at the flight of ideas. So, flight of ideas, distractibility, and talkativeness or pressured speech, right? That's your T, the pressured speech. Talkativeness, pressured speech. Flight of ideas and pressured speech, I'm just going to show you by example. Let's go with straight pressured speech. Straight pressured speech is simply the act of talking incredibly quickly. Like, there's so many words that you have to get them out so quickly, and you just want to explain to everybody this great idea you have, and you stay very, very focused, and you just want everyone to know. That's simply pressured speech. Pressured speech with flight of ideas is very common. And that looks more like, you know, one of the reasons why I like making these videos is that I really like teaching you guys about these things. And I mean, maybe it's a little bit narcissistic. I mean, like, I kind of like the sound of my own voice, and I like to think I'm really good at this. And honestly, like, I kind of like looking at my own face in the camera, but I don't know, not always. Like, I'm kind of self-conscious about my hair. Like, it's kind of all over the place. I don't know. Other people tell me I have nice hair, but, like, everybody says that. No one's going to tell you have bad hair. And my mom always gives me compliments, but, like, she's my mom. Does she, like, really believe it? I mean, I hope so, but that's flight of ideas. I went from talking about why I like this, why I like making these videos, to talking about the nature of motherly love. Like, they're all over the place, and they're getting there fast. So, agitation. Agitation or increase in goal-directed activity. So, that sort of matches with the distractibility, right? I told you about the person flipping through things. Other increase in goal-directed activity can be things like they're working on their novel. But I think they're more talking about psychomotor agitation. Psychomotor agitation is the fidgeting. Fidget, 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 fidget. I'd show you my knee jiggling, but there's actually no good way to do that in the camera without it being rather suggestive. But this person is constantly fidgeting. They're chewing on their nails. They've got so much energy, they cannot keep it inside. They might also be agitated as in irritable. That can be, that's your atypical mania. Typically we expect spectacular moods, but it can also be, whoo, are they pissed off? Just all the time, at everything, and they meet the rest of Dig Fast. Decreased need for sleep. Another good way you ask this on the wards is, hey, what's the longest you've ever been able to go without sleep without really feeling like you needed to? We had a patient, we weren't really sure if she was bipolar or not. And I asked her about the good mood thing, and she told me some stuff, and then I asked her about sleep, and she goes, sometimes I'll just kind of stay up for 3 days and clean the apartment. Now this is an important thing because I have family with trouble with this disorder, and I watched them get terrified as their son also started having trouble sleeping. Here's the trick. Mania doesn't get tired. Mania is going a million miles an hour and has more fuel to stop. This is why people don't like being treated for mania. It feels amazing. So that decreased sleep is like a dead giveaway. So let's see, how many of Dig Fast do we need? We need 3. Okay, yeah, because and they'll make it crystal clear. You've got someone who's talking a mile a minute. They're talking about all these different things. They're talking about how spectacular they are and how they understand things like nobody else does. And they, it's a crystal clear picture. But this is where bipolar gets confused with schizophrenia. How do you know that you're going to be a great rock star again? Sometimes when people are feeling this good, sometimes they might hear or see things other people don't notice. You just get really perceptive. Have you had anything like that? Well, I have, there's been kind of a voice. Ding, ding, ding. Psychosis! As soon as you have psychosis, you are in a manic episode. Hypomania is all those things I just described, but a little lighter. Talking a little quickly, you're amped. You're amped and things are going well, but you're not, on Red Bull, cocaine, and meth all at the same time. You're a little up. You can be a little up for less than 4 days. But if you are, so you need 4 days of being a little up to call it hypomania. You need 7 days of Dig Fast to be manic, unless you're psychotic. If you're psychotic, do not pass go, do not collect $200. You are currently in a psychotic manic episode. It can be pretty dangerous, and these are the people who get hospitalized for their mania. That's a very serious criteria for discussing the seriousness of someone's bipolar disorder. Have you ever been hospitalized for it? And this is why, though bipolar disorder... So let's talk a little bit about Bipolar Farm. Okay, Bipolar Farm. First line agents, lithium. Lithium is a spectacular drug. What does it cause? Epstein's anomaly in fetuses because it's a little bit teratogenic. Also has a risk of nephrogenic diabetes insipidus and some hypothyroid. I think it's hypothyroidism. Yeah, it's hypothyroid issues. Right, so that's lithium, but it's a damn good drug. Something about throwing 3 protons at somebody's brain is a really good mood stabilizer. Some of the others you can try Depakote. Depakote's a really good one. That's valproic acid. That one can't be used in pregnant women, though. That one causes neural tube defects. Oh, there's a third I can't think of, and I'm sorry, but I'm just going to have to trust your studying capacity. And your antipsychotic of choice, the one I've seen used the most, is Abilify. Abilify is magic. Abilify is aripiprazole. That one might not come up on your test, but it's such a good drug, I'd really be aware of it. It should come up. So yeah, you put someone who's someone who has bipolar features with psychosis, they get antipsychotics. And you can imagine why. They are in danger of having a manic episode that puts them in the hospital. So let's talk a little bit about timelines there. Oh, so what's the difference between bipolar 1 and bipolar 2? Bipolar 2 is someone who has had major depression, or at least depression. They've had 5 out of 9 for 2 weeks. They have had depression. But they've also had these hypomanic episodes. Sometimes they're just really up. They're just really up. And I already talked to you. Really up for 4 days, hypomania. You're not quite meeting Dig Fast criteria. You're just... And it's not interfering with your life at all. In fact, it might be doing you some good. That's bipolar 2. They've been depressed and they might have been hypomanic. But if you've ever had psychosis, you're bipolar 1. And bipolar 1 is anybody who's ever had a manic episode. It's just sort of defined that way. They also have depression, but the real definer is if you've had a true manic episode, Dig Fast for 7 days. So it's just the psychosis where it gets confused with schizophrenia. Your big tell is that someone with schizophrenia isn't talking a mile a minute and is super energetic. What does our schizophrenic patient do? They talk slowly. They might tell you things like that they are a god. I knew a god. He was nice. His other name was Frank. Not really, that's a made-up name, but I had a patient who thought he was God. Nice guy, though. And, yeah. So I think that's what I want to say about mania. Timeline, simply hypomania lasts greater than 4 days. Mania lasts greater than 7, unless you're psychotic, in which you do not pass go. You are full-blown manic, and we don't really care about the timeline. So yeah, I think that's what I got for that.